Good day, Mr. Faris. My name is Pravin, and I will start off today's presentation. My group and I have went with this type of sports known as American football or also known as rugby. Now, let's look at the types of sports injury that these types of athletes have to face. The first type of sports injury is known as a herniated disc. What is a herniated disc? A herniated disc, also known as slip disc, happens at our backbone. As you can see, here is an image of a backbone. So in between our backbone, we have these small discs that are called nucleus. When the nucleus are forced out due to trauma, when being hit, it actually goes through a tear and ends up at the outer case known as an annulus. When an athlete is experiencing a herniated disc, in most cases, they will heal on their own with no extra help needed. However, if an athlete is facing pain beyond bearable, he immediately needs surgery. This is where a doctor needs to manually align these discs into their original position. Now that we already know what a herniated disc is, now let us look at what causes a herniated disc to take place. So, generally, there are three reasons a herniated disc takes place. First, can be due to age. Secondly, due to repetitive bending movements. And lastly, is trauma to the backbone. Since we are analyzing it from a perspective of rugby, the athletes will be facing the second and third causes. During a rugby game, the athletes are required to do bending movements where they pass the ball underneath their legs. Because of these repetitive bending movements, a herniated disc can take place. Next, it is no unknown fact that American football is one of the most aggressive types of sports game out there. We have seen it multiple times where athletes or rugby players clash into each other. Athletes are manhandled. At instances during a game, a player may be hit from the back. And when this happens, a herniated disc can easily take place. Now, let us look at the signs and symptoms of a herniated disc. Like I've mentioned previously, a lot of times athletes may not even know that they are experiencing a slipped disc. This is because the athletes may not even know of the symptoms because pain will not start immediately. The pain will only start to gradually increase as the day goes by. There are two types of severe signs of symptoms to a herniated disc. First thing is known as sciatica. The symptoms of sciatica will be tingling sensation, chronic pain, numbness that will spread starting from the buttocks all the way to the end of the leg. Now, the next is a more severe and also a rare condition to a herniated disc that is known as Coda, Equina syndrome. The types of symptoms that will be faced by these are bowel disturbance, paralysis of either one or both legs, numbness in the groin area, and pain in the inner thigh. Fourthly, let's look at the type of treatments that can help a herniated disc. Like I mentioned previously, a lot of times athletes may not even know that they have a herniated disc. So with them just resting will help the herniated disc heal on its own. However, if pain is beyond bearable, these are a few treatments that athletes can do to help heal a herniated disc faster. First thing is to take painkillers when needed only. Next is to use an elastic back brace. An elastic back brace is very important because this will help the athlete from moving without restrictions and will indirectly help the backbone heal faster. Third is to meet a licensed physiotherapist. Fourth, doctors do suggest athletes that are suffering from herniated disc to be active. However, they are only required to do light types of exercises such as yoga, walking, and Tai Chi. Fifth, Once the athlete is halfway through the healing process, they are able to work out with a Swiss ball. A Swiss ball is important because they are able to regain the body's flexibility, which will yet again indirectly help with the healing process. And lastly, for those athletes that suffer from the two syndromes like I've mentioned previously, sciatica and Coda Equina syndromes, surgery will be needed to manually align their disc into original position. Among the types of surgeries that are commonly done when athletes suffer from a herniated disc are dissectomy, laminotomy, laminectomy, and lastly is percutaneous dissectomy. Last but not least, let us look at the preventions that athletes can take to prevent a herniated disc from taking place. Doctors and specialists have said that preventing a herniated disc is almost impossible because of the format of the rugby game. Like I mentioned previously, rugby is one of the most aggressive sports that is out there. So preventing a herniated disc is almost impossible. However, here are a few precautions that athletes can take to ensuring that the herniated disc is not as severe. Firstly, is to be careful on the field. Do not stand in a compromised position where your back can be easily targeted. And second is to practice exercises such as yoga and Tai Chi, as these types of exercises will increase the body's flexibility. Thank you so much. Now let's move on to the next type of sports injury.
And I'll be presenting my part, which is the concussion. Okay, so what is a concussion? A concussion is a type of severe brain damage that impairs your ability to think clearly. Headaches and difficulties with attention, memory, balance, and coordination are common side effects. A hit to the head is the most common cause of concussions. Concussions can also be caused by violent shaking of the head and upper body. Some concussions result in loss of consciousness, while the majority do not. Concussions are most commonly caused by falls. If you play a contact sport like football or soccer, you're likely to sustain a concussion. After a concussion, most people recover completely. Next, for the symptoms, a concussion signs and symptoms might be subtle and may not appear right away. The signs and symptoms might continue for days, weeks, or even months. Headache, memory loss, amnesia, and disorientation are common following a concussive traumatic brain surgery. A concussion signs and symptoms might be subtle and may not appear right away. The signs and symptoms might continue for days, weeks, or even months. Headache, memory loss, amnesia, and disorientation are common following a concussive traumatic brain injury. The most common symptom of amnesia is forgetting the incident that produced the concussion. The following are some of the physical indications and symptoms of a concussion: headache, the ears are ringing, nausea, vomiting, drowsiness or fatigue, and the vision will be blurry. So, for the causes, a strong blow to the head, neck, or upper body might cause your brain to slam against the inner walls of the skull, causing it to slide back and forth. Next, brain damage can also be induced by sudden acceleration or deceleration of the head, which can occur as a result of events such as vehicle accident or being violently shaken. These injuries disrupt brain function for a short period of time, resulting in concussion signs and symptoms. This sort of brain damage can result in bleeding in or around the brain, which can cause symptoms including sleepiness or disorientation. These symptoms may appear right away or later. Next, for the prevention. First, education and awareness are the most effective ways of preventing football concussions. Some fundamental guidelines for avoiding concussion while playing include: wear protective gear at all times, even during practice. Second, examine the playing field for any areas that are unequal. Third, include neck-strengthening activities in your workout. Fourth, side pose should be cushioned for impact. Fifth, aggression should be discouraged in practice and on the field. And the last one is proper technique should be learned and used.
Hi, my name is Amani. So for the next injuries, which is dislocated shoulder. Dislocated shoulder occurs when the upper arm bone pops up from the cup-shaped socket of the shoulder blade. As you can see in the picture that I have put into the slides, also dislocation can tear or damage the ligaments and tendons in the shoulder. The sudden impact to this joint can dislodge its bone. Okay, there are few factors that cause this injury, which are player clash hardly during games. So there is a big possibility for players hurt their shoulder. Next is when the player fall. As we all know, that rugby is an aggressive sport, right? So there is a possibility to the player falls and cause this injury. Okay, from the past experiences, maybe past experience means that there is a chance that players did not receive treatment that he or she need to do before the next tournament. So if they did not get the proper treatment, it will cause dislocated shoulder. It will get worse day by day. Okay. Next is there are symptoms that show this injury. For the first one, it will be visibly deformed or out of place shoulder. It's like your bones is pop up from here, and that. It's also a sign of swelling or bruising at the shoulder. Here, experience the intense pain and inability to move the joint. You can move your shoulder like usually. So, but rarely this injury will cause numbness, weakness, or tingling in the areas such as the neck or down the arm. It's very rare to see. Okay, there treatment. There, of course, there's a treatment for this injury. For example, if players have a serious injury to the shoulder, the coach need to seek medical attention. Okay, then the physician will put the bone back into the place. They will do an X-ray to confirm the injury. It will experience a lot of pain after the treatment, but a physician will prescribe a painkiller to relieve the pain. A doctor can help players to strengthen and rehabilitate the shoulder. Next one is, for the worst case, a surgery may be required if the doctor could not move the dislocated shoulder bones back into position by manipulation. So if the shoulder is getting worse, it might be surgery. They will need surgery. Okay, prevention is better than cure. So, the player or the patient need to rest the shoulder for a couple of days. They also they have to limit heavy lifting or overhead activity. They need to apply ice. Apply ice in the shoulder at the shoulder is will reduce inflammation and pain. The player should participate in exercise that build shoulder muscle, posture, and core stability. Furthermore, players should also avoid falls in the next tournament or games. Also, most of the people did not wear a proper protective gear when they play rugby. So it will cause this injury eventually.
Hello sir, my name is Sangeeta and I will be presenting about hamstring hamstring strain, also known as pulled hamstring. Hamstring strain is the second most common injury that happens among rugby players. It is defined as stretching or tearing of the leg muscles. Three muscles are involved in this hamstring strain. Those are semimembranous, bicep femoris, and semitendinous. Hamstring strain can be mild or severe. It is based on the level of injury on the muscles, which is divided into grades, and I will be explaining in detail in upcoming slides. The mild strain does not need surgery, whereas the severe ones do need surgery. Hamstring strain falls under chronic injury, which means injuries caused by continuous or repetitive pressure, force, or stress on a particular body part for an extended period. Rugby players need to be agile and involve fast leg movement. Due to that, players had to put continuous pressure on their legs in order to move fast and quick, which results in hamstring strain. Causes of a hamstring strain. Improper warming up. Warming up is important and needs to be done before doing any type of activity. It helps to stretch muscles and get our body ready to do activities or exercise. Next point is overdoing practice. When our body is tired, it is prone to injury. One, forcing themselves to practice even after they reach their limit will cause them to get injured. The third cause is imbalanced leg muscles. It means one set of leg muscles are stronger, weaker, or tighter than the opposite group of muscles. The fourth cause is an inadequate game technique, where one does low quality practice before a game, which for sure makes players be less prepared and vulnerable. The last cause is continuing game right after recovery from a previous hamstring injury. Putting pressure on a muscle that just recovered would make the situation even worse and result in getting injured in the same area. As I mentioned earlier, there are grades for each level of severity of hamstring strain. Grade 1 is tearing of only one or two muscles, which we can see from the picture in the slides. Grade 2 is a more severe partial muscle tear. Grade 3 is a complete rupture of muscles. Signs and symptoms. A sign is an observable phenomenon that can be identified by another person. Symptom is a subjective experience of a potential health issue which cannot be observed by anyone. It can only be felt by the injured person. The sign of grade 1 hamstring strain is minimal swelling on the injured area. Symptoms are minor pain while running or performing an activity. The injured person will find it difficult to run or move their leg, but not as severe as grade 2 and grade 3. Pain in grade 1 is lower compared to the other two grades. Signs and symptoms of grade 2 hamstring strain. Signs are swelling and bruising, also known as discoloration. Purplish marks can be seen around the injured area. Symptoms are sharp pain while running or performing an activity. The injured person will find it much more difficult to straighten their leg and to simple leg movements. Is grade 3, where the injury is more severe compared to grade 1 and grade 2. It is impossible for the injured person to walk and move their leg. They need someone to help them to walk and need clinical examination. As a sign, the discoloration around the injured areas will cover the whole skin of the injured area. The symptom of this grade is burning and stabbing pain in hamstring muscles. Treatment for hamstring strain depends on its grade and severity. Grade 1 hamstring strain needs a basic RICE treatment, which is rest, ice, compress, and elevate. RICE is the basic first aid given to keep the injury from getting worse. For grade 1 hamstring strain, RICE treatment will be sufficient to reduce the swelling and help the strength to heal on its own. The procedure of RICE treatment is explained in detail in the report. Surgery is not required for grade 1 hamstring strain since it is not as severe compared to the grade 2 and 3. However, if the pain seems to be unbearable and affect the injured person movement, they should seek professional help. Best prevention for a hamstring strain is players should do warm-up exercise and cool-down session before playing their game. A good warm-up exercise takes around 20 minutes, starting from simple to full-paced warm-up. Warming up and cooling down help players prepare their body for the game or any physical activity. Next is proper diet. Food is very important for humans, so a proper diet is a must to give strength to the body. Healthy food provides energy to the muscles and help them to stay strong. As much as physical preparation is important, mental preparation is equally important. Not being mentally prepared for a game or training will lead to players lose focus and get injured. Players should be physically and mentally strong to pay attention and avoid injuries during the games or training. Lastly, an adequate amount of rest. In between training sessions and rugby games, all players should take an adequate amount of rest. Rest is important to keep mental and physical health in check.